Hi. Hi. It's Rita at Gold Medical Jobs. And so COVID-19, the coronavirus, is on a lot of people's minds. And I thought we better talk about it because we're healthcare professionals and people look to us. People say to me, neighbors or just people I meet, visiting my mom at her assisted living senior facility, other nurses, doctors, people I come in contact with. Everybody's like, what's your take? What's your take? So let's talk about it. Okay, so the coronavirus, or it's COVID-19, is a flu virus, and it has been around since 2003, actually technically 2002. And so let's backtrack. What happened in 2002? We started hearing about SARS, capital SARS. What is that SARS? I have to refer to my notes. Severe acute respiratory syndrome, right? So that was an animal to human transmission. It was the most severe respiratory we had, some deaths related to it. And that was the original coronavirus. So now we're dealing with corona. I don't know. I look crooked to myself. Let's see. I'm always backwards. I'm sorry. Okay. So SARS, the original SARS coronavirus, actually started in China as well, in Singapore back in 2002. It was a worldwide epidemic back then. Well, I don't know if it was an epidemic, but yeah, I think it was. And so it was the history of it as it began in November 2002. We probably started hearing about it in 2003, and it was contained worldwide, okay, by July 2003. So that is 7 months, right? November, December, January, February, March, April, May, June. Okay, I'm sorry, 9 months. So in less than 9 months, the SARS was contained. Okay, so which is great, because that means that basically containing a virus and isolating people who are contaminated is effective, because we don't have antivirals. We have Tamiflu, and I say it because, like, yeah, it's Tamiflu. Does it really help? No, prevention is the way to go, and that seems to be what everybody's doing. But let's talk about, so that's a little bit of the history of the coronavirus. It isn't brand new, didn't just appear. Scientists and doctors have been studying it and knowing about it for quite some time. And prevention is like prevention of the flu, universal precautions, which I'll go over as we speak here in these next few minutes. But what is the big difference about COVID-19, and what is it possible to do? What is probably happening, and how can you do your best as an employer and as an employee and as a healthcare person in particular? Okay, so what you can do is arm yourself with knowledge, be a good practitioner of universal precautions, and know some facts. Okay, I heard a rumor, so I don't know if it's true, but it's from my son-in-law, because he pays attention to the news, and he said, Rita, it doesn't seem to be affecting children. And out of all the deaths that occurred, thousands of deaths in China, only less than less than a handful, less than 5 were children. Okay, so I don't know if that's true. I didn't get any research done on that, but isn't that fantastic? Okay, here's the thing. In the United States, right, in the continental United States, it may or may not include Hawaii and Puerto Rico and, you know, some of our territories. But according to the CDC, the Center for Disease Control, so I get a lot of information from the Center for Disease Control, and I have to remind myself, because I do use the CDC a lot, and have as a nurse in my clinical days, and which haven't ended yet. But the CDC is like my go-to for information. So according to the CDC, 12,000 deaths from the flu. So let's hope a lot of you out there, healthcare professionals, friends and family of healthcare professionals, people at risk, meaning people that are elderly or suffering, you know, or more febrile, is febrile, that's not the word. People who are a little bit more at risk, you know, that would be somebody with a chronic disease, maybe undergoing some chemotherapy or radiation treatment. So you're a little bit more vulnerable, your T cells have been affected. So the most vulnerable would be the very young and the very old and those that are ill. And so definitely get your flu shots every year, okay? If you haven't gotten them, not too late. Go ahead and get it. So a lot of deaths, 12,000. But the CDC adds to that info, and that's between October and February. October, November, December, January, February. In the last 5 months, 12,000 deaths in the United States. And we're not as populated as China. It's very high population in China. And the possibility of as many as 30,000 deaths. Okay, so keep those numbers in mind, 12,000, 30,000. Due to the regular old-fashioned, disgusting, if you've ever had it, I had it 1 year. Oof, 1 year that I'm aware of. I may have had it as a child, I don't know. Yeah, that was a bad year because I had respiratory involvement, so I was pretty much recovered from the basic flu, but I had respiratory symptoms that lasted months. I was exhausted. Anyway, oh yeah, let's compare that number, that 12,000 to possibly 30,000 deaths that have occurred in the United States due to the flu to the number of deaths from the coronavirus, the COVID-19 in the United States. It's under 10, it's 9. It's 9, okay? So good to be aware, but calm down, right? So that's my take. We need to calm down. We need to be health aware, germ aware, but not a germaphobe, and practice good old-fashioned hygiene and universal precautions, okay? Do you remember that? Everybody reviews this stuff annually. If you're a healthcare employer, if you're a healthcare employee, we do this stuff annually, okay? So, so when people want to know what's your take on it is, oh, well, I think we should be careful. Do you know about hand hygiene? You know, do you know to cough into your elbow? Do you know that places where people repeatedly leave germs because they're not doing good hand washing, you know, get in all the crevice, you know, all those nooks and crannies of your hands, you know, push up your sleeves and do a good job, you know, sing happy birthday, twinkle, twinkle, little star, you know, spend some time getting clean. But not everybody does that. You know, kids, they do like, they run their hands under the water, you know, they talk to themselves, they look in the mirror. They're not really doing great hand hygiene. So what are those places that people routinely touch over and over and over? Doorknobs. Doorknobs. Germ city. Germ city. So remember, if you've touched anything, and pretty much we touch things all the time, wash your hands. Wash your hands. You see me all the time my hair gets in my eyes and I fix my glasses and I'm touching my face. Well, if there's respiratory infection, I just touched a doorknob, um, a doorknob at my mother's facility, okay, where there's lots of healthcare employees, there's lots of visitors, there's, 180, something like that. It's a huge place where she lives. And even though it's divided into independent living, skilled living, skilled nursing, and memory care. So a lot of different people coming and going in that place. So what do I usually do? I bump with my elbow. I bump the electric control for the handicap. I have to use it a lot anyway because my mom is pretty much wheelchair bound. She had a big stroke, so she can transfer, but she can't really ambulate without somebody supervising her. So she's in a wheelchair a lot. So we're constantly, in our visits and our things that I do with my mom, getting into a car, getting back into her house, getting, in and out of the facility, we're using wheelchair, either a manual or an electric. And so I'm always hitting that handicap thing with my elbow. So, I don't scratch my nose with my elbow or put my elbow in my ear. It's my hands, right? It's my hands. And then once I enter the facility, what do? I have to sign her in and out. I use a pen that somebody else used. I go over and I do the hand hygiene with the the alcohol-based sanitizer. I use the sanitizer on my hands, coming and going and coming and going, okay? So there's a bunch of things you can do. You can try to remind yourself not to touch your face and your nose and your mouth. You can remember that are things like doors and all the things in the bathroom, the sinks and the flushers and the commode. God, my words, use your words. When you go in and out of the stalls, those doors, and you're locking them, everything's contaminated. So try to use your elbows, your feet, your hips to open and close things as much as possible. And assume you're using your hands and just wash. Wash when you enter, wash when you exit, wash, right? Cover your cough, watch out for other people that are coughing. Just universal precautions. Okay, so now let's go back to some information, okay? What's possible, what's probable? Probably the COVID-19 is a little bit more, it's a stronger strain. It's probably a little stronger and than what we saw back in 2002, 2003. What we know, what's a fact about it, is that it transmits in the second week. So sometimes when a cold is coming on, you don't notice it. And that's kind of the danger. Are you sick? No, I feel fine. But then, you get a scratchy throat or you're just not as energetic as you have been. Have you traveled out of the United States? No, but you may have traveled. You may have taken a road trip, interstate road trip. You may have taken a plane, from one coast to the other, from one state to the other. And so people on those flights may have been traveling abroad. And so you just don't know what you're exposed to, particularly if people are in their first week of acquiring a virus. It's in the second week that you're able to transmit it. So, so let's now talk about universal precautions. It's your basic precautions, and you have to understand what bloodborne pathogens are and what do you do about it. Okay, so there's 4 basic things you do with your universal precautions. One is hand hygiene, okay? And just because you wore gloves doesn't mean your hands are clean, because you have to take them on and off and germs exist. So if you're entering a room and there's some bloodborne pathogens that you have to be careful of, that means secretions from any body part, blood, secretions, oh, what's that other one? Secretions and blood and feces and urine and all of this stuff. So we're protecting ourselves and we're protecting others. So you're always doing hand washing. Sometimes you're donning gloves, okay? So you do your hand wash, you put on your gloves, and you go into a patient's room that is suspect or actually has been diagnosed with a bloodborne pathogen or respiratory infection. And then what's the next step? A mask. You protect yourself and you protect them because they're immune compromised and because you don't want to get the germ. You're taking care of several people. So face protection. What does that mean? Oh, well, nose, mouth, eyes. Okay, so if you're not wearing glasses like I am, there's usually protective goggles. So you put all that on. And I know in the many years that I was a clinical nurse, not that I'm not, but I'm not as clinical as I once was. I would apologize because you come in looking like, you know, you're totally protected from your patient. But I always explain to them that I'm protecting you as well as I am protecting myself. I would prefer not to have all this garb on. Please don't be offended by it. I can take care of you just as well with it as without it, but I can take care of you better and protect you better by wearing these things. So I know it's tough and uncomfortable. And once you get well, we'll stop doing all this. So talk to your patients and explain to them the necessity for it and the inconvenience of it and the discomfort that they may feel. You know, they just feel like a pariah. They feel like outcast. So, you know, we have to be sensitive to that strain. Now, is a gown necessary? Sometimes it is. If there's diarrhea involved, if there's blood involved, so sometimes that's another piece of dealing with the bloodborne pathogen. And then environmental cleanliness. Okay, so we need to work with our team of housekeepers, let them know what we're dealing with, what the precaution is, what they need to wear, and what you know, maybe talk to the leader of environmental services about what needs, you know, if there's bleach needed or whatever's needed, or sometimes even the air, you know, if it's a tuberculin type of thing, and maybe with this COVID thing. So those are the four major pieces of universal precautions. So hand washing is key, glove donning, and gloves between patients, and hand washing between patients. And I became in the practice in my personal life of washing my hands when I enter a restroom before I take care of myself down in my private parts below the waist. I wash my hands. I'm just like a chronic, goofy hand washer. And then when you're done in the restroom, you wash your hands again. And then if you can, if they have paper towels, a lot of facilities now are just using the air dry, but I use my pinky or something to get out. Like in the movie theater, for example, there's the air dryers, you know, and so I would love to push open the door with my elbow, but it's not always possible. Sometimes you have to use a handle, and I'm thinking, I just washed, now I have to I have to touch the dirty doorknob or the dirty handle. So bummer. But you can use a piece of tissue paper or paper towel, if possible, you know, to open that door. So start using your elbows more if possible. That's my recommendation. What else did I want to talk about? What's possible and what's probable? What's possible? Can we get sick with the coronavirus? Yes, we can. So several people in the United States have gotten it, have been quarantined. I'll tell you a story I heard today about that a doctor that is a friend of my friend Mary, you've seen her here on Gold Medical site, and she runs Vizenda, a wellness company. And her friend, a physician, was at services at his synagogue in New York, and somebody came down with the virus. So everybody's quarantined. They're not quarantined in the synagogue. By the time they found out, people had gone home. So they're containing it. Okay? So people are staying home. They're not visiting with others. They're not traveling. And I'll keep you posted. I don't know how long that quarantine will last, but that's great. I mean, it's horrible that somebody got sick, but isn't that great that they found out? They notified everybody that was there in the facility at the synagogue, and everybody's being monitored, and hopefully that prevents the spread, right? So is it possible? Yes. Is that my friend's doctor friend going to get it? Probably not. Okay, what's another thing? So, yeah, we know that it's a respiratory. We go back to the SARS. The original coronavirus was a SARS virus, which is a severe acute respiratory syndrome. And so what was I going to say about that? Oh, so the good news there is that it was contained rather quickly. I think the good news here too is that people are paying attention. They're using the hand sanitizer. They're washing their hands a lot. We're quarantining where we can, like the international flights are being quarantined in San Diego, where I am, and throughout California. There was a cruise ship. Darn, that should be a fun thing, right? So they're quarantining the people on that cruise ship. So what's possible and what's probable? What's possible is that, yeah, you could get it, but you're like one in millions and millions of people in the United States. And is it probable that you will get it? Probably not. Is it possible that we will have a vaccine in the future? Yes. Is it probable? Yes. That's a double yes. You know, in San Diego, I already heard good news about what's going on in the research in San Diego. I think we're really close to having a vaccine, and how wonderful, because this is a really severe virus for the people that have contracted it. So a vaccine is going to be wonderful. What's possible? What's probable? What did I want to tell you? Oh, I did want to tell you this. The CDC, the Center for Disease Control in the United States, has a free course. And this is great for all those healthcare employers out there. And this is great for people like me that just want to know more. It's called the Nursing Home Infection Preventionist Training. The Nursing Home Infection Preventionist Training. So there you go. Leaders and workers, that's for us. That's for us. So you can access that on your internet. You can talk to your supervisors about it. It's there for us. Let's just do some basic. Okay, this is what I know is going on in long-term facilities. And I am like kind of a direct recipient, even though I don't work in a long-term facility. I visit one frequently because my mom lives there as an independent person. And boy, is she independent. She's swimming today. I'm waiting to hear from her so I can go bring her some things she needs and help her with some stuff. But this long-term facility notifies me all the time when they're concerned. So I feel like they have done their homework. The coronavirus is real. Not too many seniors, and I'm talking, my mom lives with a lot of seniors that I want to say are in their 70s, 80s, 90s, and above. I mean, there may be a few that are younger, but for the most part, they're, I would say, 70 and over. They're not traveling to China. They're not traveling on trains, planes, you know. They're cruise ships. Their world is a little smaller. You know, they may go on a field trip. As a matter of fact, they're going to, we're in San Diego County. They're going to LA County to hang out at the Disney, downtown Disney. They're going to have some fun next week. So they do outings like that, or outings to a theater, or performance, and they have performers come in. Yeah, it's rough. They have lots of entertainment almost on a daily basis and outings, but they're not doing international travel. For the most part, they're not getting on cruise ships and planes and jets and so forth. So that's not where their issues come in. Their issues come in with visitors. Okay, so if you're running a long-term facility, a skilled nursing, a memory care, an assisted living, any of these facilities, rehabs, long-term and short-term rehab, let your visitors know that if they have any signs of a respiratory infection of any kind, please don't visit, okay? And that's number one. That's number one. And I did get my message. They send me a text and they leave me a phone message with that message. So I know that where my mom is, that they're paying attention, they're doing their homework, and they're getting the message out. I'll see today when I get over there, because it's been a few days. I didn't see any particular signs there. I'll see if there are any signs today saying if you are sick, have a cold or a cough or respiratory infection, please do not visit until you're well. So those signs should be out there, but they're notifying the regular visitors like myself and the other residents whose family and friends visit them regularly. Two, have a sick policy for your employees. Like my daughter is very, very pregnant. She's in the last couple of weeks of her pregnancy, and she's still working. She likes her job, but she also knows that she's going to have a leave, and her income's going to be limited, and she's also planning on going back to school, so her full-time status will change. So she's working as much as she can before the baby arrives, and but if she's feeling lightheaded or having any signs and symptoms of anything at all, she does not go to work, but it's a hardship because she doesn't get paid. So that may be the case at your facility. You may have limited sick days, but maybe there's some other PTO like Christmas or New Year's or Thanksgiving or July 4th or, you know, President's holiday. You may have some PTO that you offer or vacation time, paid time off for your employees that they could trade if they're feeling sick and they don't have sick days, or they have very limited sick days and suddenly they have a cough or diarrhea or fever. I mean, you should not work under these circumstances. My daughter works with very young children, and a lot of times the children arrive sick, and if they're not right there to catch them when the parents bring them in, boom, the kid is in there sneezing or having diarrhea or whatever, and they have to bring that child to the nurse. But the exposures occurred already, both to the employees, the other students, etc. Same thing in a long-term facility or any healthcare facility. If your employee is ill, please ask them to stay home. If they say they're concerned about getting paid, say we'll talk to HR. We'll do what we can for you, so that it's not a hardship. So maybe there can be some trade-off in PTO, vacation time, whatever, to accommodate taking a sick day or two. What else? Okay, so in a long-term facility, particularly my mom, even though she is independent, they can assess her. You know, if my mom shows up at the dinner table and she's coughing and she's pale and she's weak and, you know, they see a change in their residents, that's the healthcare worker, that's the healthcare employee, and employer's job is to constantly assess your clients, okay, and make recommendations there. Another very, very important thing, we talked about it a lot, we'll say it one more time, in a long-term facility, hand hygiene, hand washing, so important. There should be in these facilities, and there are, I see them all the time, and I use them all the time, hand sanitizer dispensers. Those dispensers often also have a rack for the mask and a rack for tissues. So how wonderful is that? You wash your hands. If there's any question at all that someone is sick, wear a mask, protect yourself from them. And there was a flu virus at my mother's place, intestinal flu that occurred before Thanksgiving and lasted almost to the end of December, I want to say. And so most of the employees were not only practicing hand washing, but they were wearing masks as well to protect themselves. Because if you get sick, you can't help your patients and your clients, right? So hand washing. And then my fifth thing is know your respiratory hygiene and your cough etiquette, okay? Your respiratory hygiene is to cough into your elbow, to use the personal protective equipment I just spoke about, a mask if needed, and then entering and exiting a room. The minute that mask gets some droplets on it, it's already contaminated. So know to remove the mask, remove the gloves, do good hand washing, good hand sanitizing. And then here's the thing, using that protective equipment, that personal protective equipment, such as a mask, gloves, hand sanitizer, hand washing, tissues, paper towels, right? As you use them and abuse them and contaminate them, you have to throw them out. So make sure if you're going to have all that wonderful stuff, have trash cans available. So outside a patient room, inside a patient room, have trash cans. Get rid of that stuff. You know, this is an interesting thing. A friend of mine years ago mentioned it. It was after his mother's passing, and she lived to a ripe old age, but he really felt, they said that what really got her in the end was a urinary tract infection. And he really believes, he's an engineer, he's not a healthcare person, but he really believes that we need to remind our senior adults to get rid of their tissues. They hate to be without it. They're sniffling. I don't have one to demonstrate. They're sniffling a lot. And anyway, so he really believes that she cross-contaminated herself because she always, every piece of clothing she had, wherever she sat, on the table, there were tissues everywhere. And how do you determine what's clean and what's dirty? So they just hate to be without it. So my suggestion would be that if you're working in a facility, offer Kleenex and then offer a place for them to dispose of it. It's easy enough to get them, you know. And so, you know, years ago with the hankies and the handkerchiefs, which is lovely, and I still have a few myself, but I do laundry like pretty much daily, so I can wash them. But I use that mostly because tissues come from trees, and I just like a hanky, you know, to kind of blot my face when it gets oily, or to catch a tear when I have a tear or whatever. I don't usually blow my nose in them. I do use tissues for that, but I just sort of like having a hanky handy, or a handkerchief if you're a man. But our elderly, our people that are living in residences and nursing homes and skilled facilities and long-term places, they should have tissues available, and they should have a place to dispose of them, and encourage them to dispose of it. Say, here, would you like to, you know, and hold out the paper towel, or hold out the trash can, and help them dispose of it. Encourage them to dispose of it. Okay, I feel like I'm talking like crazy. Finally, back to the COVID-19, the coronavirus that is the talk of the town and every news station. What are the signs and symptoms? Has anybody talked about that? Not so much. The signs and symptoms are that of colds and flu, because guess what? It's a virus that just happens to be a strong one. So the signs and symptoms are fever, cough, shortness of breath. Can you have diarrhea? Sure. Can you have body aches? Sure. That goes with the fever. And healthcare workers, I just want to tell you, evaluate yourself, evaluate your clients and your patients, and report when necessary. Okay, that's what your supervisors are there for. And is it possible to get the COVID-19? Sure. Is it probable? Nope. Okay, so enjoy the rest of your week. I'll check in with you again, and hopefully I have a nice joke or something for you, because I feel like this was a tedious talk, but an important one. Okay? Okay. No myths. No myths. Just a bunch of facts. Okay? Stick with the facts. If that rumor, I did mention that rumor that I heard from my my lovely, wonderful son-in-law, that children are not succumbing to it, and isn't that good news? I'm happy for our future that that's true. I'm going to sign off here. Have a great day. Talk to you soon from Gold Medical. Thanks. Bye.